Niacinamide, also known as nicotinamide, is a form of vitamin B3 and is used to prevent and treat niacin deficiency, which can cause symptoms like diarrhea, confusion, redness/swelling of the tongue, and peeling red skin. Unlike niacin, niacinamide does not help correct blood fat levels and cannot be substituted for niacin if you are being treated for a blood fat problem, such as high cholesterol. Niacinamide is often used instead of niacin because it causes fewer side effects, such as flushing. Niacin deficiency may be caused by poor diet, certain medical conditions, or long-term use of certain medications. It is best to get your vitamins from healthy foods, but a multivitamin may be recommended by your doctor instead of niacinamide. Vitamins are essential for supporting the body's metabolism and maintaining good health. When taking niacinamide, it's important to follow the instructions given to you. Typically, it is taken once or twice daily. Make sure to follow the directions on the product package or as directed by your doctor. If you have any questions, it's best to consult your doctor or pharmacist. If you are taking extended-release tablets, do not crush or chew them as this can increase the risk of side effects. Only split the tablets if they have a score line and you have been advised to do so by your doctor or pharmacist. Swallow the whole or split tablet without crushing or chewing. If you are taking medications to lower blood fats, such as cholestyramine or cholesterol, it's important to take niacinamide at least 4 to 6 hours before or after taking these medications. This is because these products may bind with niacinamide, preventing its full absorption. If your condition persists or worsens, or if you believe you have a serious medical issue, seek medical attention immediately. Niacinamide is generally well tolerated in usual doses. Upset stomach, nausea, and diarrhea may occur. If any of these effects last or get worse, notify your doctor or pharmacist promptly. If your doctor has directed you to use this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including nausea/vomiting that doesn't stop, black/tarry stools, easy bruising/bleeding, swelling of arms/legs, signs of kidney problems, such as change in the amount of urine, dark urine, vomit that looks like coffee grounds, yellowing eyes/skin. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects and potential allergic reactions. Before starting niacinamide, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. If you have liver disease, stomach/ulcer problems, bleeding problems, diabetes, gout, or kidney disease, make sure to consult your doctor or pharmacist before using niacinamide. If you have diabetes, niacinamide may increase your blood sugar levels. It's important to check your blood sugar regularly and share the results with your doctor. If you experience symptoms of high blood sugar such as increased thirst or urination, make sure to tell your doctor right away. Your doctor may need to adjust your diabetes medication, exercise program, or diet. If you are pregnant, it's important to inform your doctor before using this medication. Additionally, if you are breastfeeding, consult your doctor before using niacinamide, as this drug can pass into breast milk. When taking niacinamide, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's essential to check all prescription and non-prescription medicine labels carefully, as vitamins and dietary supplements may also contain niacin or niacinamide, nicotinamide. Taking these together may increase your risk of side effects, so it's best to consult your doctor or pharmacist for more details. As for the daily dosage and optimal timing of niacinamide, it's recommended to follow your doctor's advice. Niacinamide has various benefits, including supporting skin health, maintaining normal function of the digestive system, and aiding in a healthy nervous system. It's important to take niacinamide as directed by your healthcare provider for the best results. If you or someone you know has taken too much niacinamide and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, while in Canada, you can contact your provincial Poison Control Center. When taking niacinamide, your doctor may want to monitor your blood sugar and liver function with lab tests. It's important to keep all medical and lab appointments and consult your doctor for more details. It's best to get your vitamins and minerals from healthy foods, so maintaining a well-balanced diet is important. B vitamins, including niacin, can be found in meat, fish, poultry, enriched/whole grain bread products, and fortified cereals. If you have a niacin deficiency, you can increase the amount of niacin in your diet by eating more of these foods. If you happen to forget a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next one at your regular time. Do not take a double dose to make up for the missed one. Make sure to check the storage information on the packaging of niacinamide. If you have any questions about how to store it, you can ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. Do not throw niacinamide in the toilet or down the drain unless told to do so. When it expires or you no longer need it, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.